IMHO Talk Show. Welcome back, family. Thanks for staying tuned. You got Charles,
Max,
Razor,
Ron.
You know how we do. You can reach us online and keep the communication going. For this special episode, another follow-up we're doing on our COVID-19 update, IMHO COVID-19 update. We've been talking to the professionals in our area, to hopefully bring a little ease to the community, to remind everybody that we're in this together and there's still the resources available. So to help us close the show, we have Dr. Ebony Hilton, medical professional here in our area, to squelch all the myths. I don't know if you know that, Ebony, but it's on you right now to clarify all the conspiracies.
I've heard them too. People talking about we got Wakanda blood. I heard all of them.
Hey, that's right.
Oh goodness.
Razor started that one.
Wakanda blood.
Look,
Right.
but have y'all heard that though? Because that is something that's going on out there, and it should be said that because even Idris Elba has tested positive, Kevin Durant, different people, and they wanted to make it, even though they are saying that they haven't felt any symptoms, but they tested positive.
Right.
But there is something out there that, because there were actually some medical professionals that were saying that people with from African descent, African genetics were some were saying they were immune, and some were just saying less likely to contract it. What I understand, Ebony, you correct me if I'm wrong, if you heard this. Part of it is that the anti-malaria medicine that a lot of people take when they go to Africa, or that Africans take, it actually has helped prevent or block that contagion. I've heard that. If there's any truth to that?
Right.
Yeah.
And that's true. But what we have to remember is that in America, we're not taking anti-malarial pills, right? And so at this point, we really don't have, so you hear about 45, and that's what I call him. But you hear about 45 talking about these different medicines that we can use. But quite honestly, there's no tested true medicine for this virus because we've never seen it before. So whenever people are talking about this COVID-19 or coronavirus, they say, oh, I've heard of coronavirus before, and you have. So the way I explain what coronavirus is that coronavirus is almost like the name Lewis, right? Your last name is Lewis.
Right.
Your cousin's last name is also Lewis. You have different family groups with that same last name, right? Mm-hmm. Coronavirus is the same thing. Coronavirus is the umbrella for a number of different strains of viruses. And each strain is uniquely different than the next. That's why they get their different names. So with coronavirus, you literally can have anything from the common cold to what was the SARS epidemic. I don't know if you guys remember in 2003. There was a big epidemic called SARS that Chinese people started wearing the mask in the airport, those kind of images. Yeah. Same family as far as coronavirus family. So this one, COVID-19, is a brand new strain. The body has never seen it, which is what's making it so contagious and so deadly, because your body doesn't have any immunity to it because it's never seen it before. So it got its name from 19 because most people say, why is it called 19 and not corona or COVID-20, right? Yeah. Well, the first case was actually in China on November 17, 2019. So hence the word 19. But you'll also hear people compare this to the flu. And what I have to say from the hop is that this is 10 times more dangerous than the flu. It is more contagious than the flu, and it is more deadly than the flu. So to give you an example, we use this number called the reproductive number in medicine to describe just how contagious something is. So for the flu, we say for every one person, so if I had the flu, I am likely to give the flu to 1.3 other people. With the coronavirus, it's COVID-19, if I have it, I am more likely to infect 2.5 more people. So it's twice as contagious, 2.5 times more contagious than the flu. And in comparison to how many people die, every year about 56,000 Americans die from the flu. This coronavirus, this COVID-19, we're estimated worst case scenario between 200,000 and 1.7 million Americans will not see the year 2021.
Oh my goodness.
And what we have to, and so I have to stress to my people, my community, to say,
Right.
I know you hear these stories about Wakanda, and I do believe we're fierce, but this thing does kill. And if you look at New Orleans right now, we're seeing very young Black people dying left and right. New York, same thing, left and right. This is not something to take lightly. You need to practice social distancing. You need to, like, I'm in my house, right? Looking a mess. Like, I'm in my house, my dogs are barking. But it's one of those things of, you have to keep yourself isolated as much as possible. If you do not have to leave your house, you should not leave your house. If you are leaving your house, you need to maintain a distance of at least 6 feet. And that's including with your cousins, because cousins can give it to you too. It literally is just exchanged through the droplets. So when you're talking, if you laugh really hard and your diaphragm kind of does that push, you're pushing fluid out of your mouth. You don't have to be sneezing on someone in order to get the droplets on you. So that being the case, distancing yourself, washing your hands constantly, not leaving your house unless you absolutely have to, are going to be the main things that keep you from getting the disease in the first place. I might get mail delivered to me right now. Y'all, this
That's awesome.
So what's this thing we hear about people who contracted can recover from home? It's just like a virus, and if you stay home and just kind of take care of yourself, then you'll be fine.
Right. So a couple different things. So it's just like, some people can take penicillin and some people can't, right? Everyone's body reacts to things in different ways. So there are some people who will get this disease, and literally we're estimating 80% of the time people will get this disease and have absolutely no clue they have it. Or if they do have a clue, it's really mild. They say, I feel tired, I have a runny nose, basically like the coronavirus form of the mild cold symptoms, right? So that's 80% of the people. The other 20% are kind of broken down into thirds. There's a third. Sorry, thank you. Y'all, I really am getting mail delivery. Thank you. Sorry.
Are you fine,
thank you. So you'll have people who the next tier to that of you don't have any symptoms is you have this kind of mild myalgia, so your muscles ache, you feel really, really tired. Some people are complaining of feeling a really bad headache. Yeah. Some people complain of ear aches, loss of taste, different changes to their hearing, some really weird symptoms that aren't necessarily reported on the news. It's not just a cough that they're seeing. They're seeing a lot of ear, nose, and throat kind of symptoms. Then Then the other third of people are having the fever. They're having the kind of cough, but they're also having difficulty breathing, right? And these are people, when you get to this stage, we say for sure you need to come into the hospital. And I'll talk about the other stages prior to that. The third stage is, now I'm having chest pain, I'm having difficulty breathing. The final stage is, now my organs are starting to say, I can no longer work. My heart isn't working in the same way. My lungs aren't working in the same way. My kidneys aren't working in the same way. And those are the people that we're seeing in the ICU, that you're hearing people say, we need the ventilators. It's because those organs are saying, I'm no longer able to do it by myself. So, so people oftentimes, the big question is, well, if I'm having any symptoms at all, if I'm having a fever and I'm having a cough, should I come into the hospital? And this is, I know this is hard to hear, especially when you're hearing people dying from this disease. Right. But if you're having mild symptoms, just like a really bad cold, really bad kind of cough, should you come into the hospital? The answer is no. And most time people say, well, why not? If I'm bothered, why not? Well, because for one, if you're fighting off a virus, your immune system is already weak. And what we know is in the hospital, regardless if we like it or not, there's bacteria, there's other viruses that you can potentially get. And so if your immune system is weak, if you can take care of at your home by yourself, then we say stay at home, hydrate yourself, take care of yourself, but don't bring yourself into the hospital where you can potentially get worse, for one, but for two, because you're going to be taking up a bed of someone who could be to the stage of, I can't breathe and I need this room in order to live. And that's the difference. The kind of example I give is if you were to walk down some stairs and you twist your ankle, even though your ankle is hurt and it's swollen and it's hot and you can't really put pressure on it, you wouldn't come into the hospital and say, I need an x-ray and I want you to do surgery on my ankle immediately. You would say, I hurt my ankle. I'm going to sit over here on this couch. I'm going to put my leg up for a while. I'm going to put ice on it, and I'm going to see how my body can heal itself. That's what we're asking you to do, to think of it in that analogy of, if you're having these symptoms of fever, a cough that's really nagging you, but your breathing feels that you feel adequate, I would never tell you to not call your doctor. I think in every single stage, you should call your doctor and let them know what's kind of happening. For one, especially if you are starting to feel more and more symptoms, you need to call your doctor to say, hey, I'm having these symptoms. Am I supposed to come to you, or am I supposed to go to the hospital? Because not all doctors' offices are equipped to take care of you in that way. They don't have the breathing machines. They may not have even tests for you at that site. So if you were to call them first to get a heads up of, if they say, hey, we don't have any tests and we can't take care of you, then you're wasting 15 minutes driving across town when you could have been sent over to the right place. That makes sense?
Yeah, absolutely.
Absolutely.
Yeah, thank you for that information. And so, Dr. Hilton, we're going to take a quick break, and we're going to come right back with a couple more questions. But yeah, wow, we appreciate this very in-depth and much-needed information.
For sure.
So yeah, so IMHO family, stay tuned. We will be right back with medical professional Dr. Ebony Hilton on IMHO. Remember, it is online. Keep the conversation going, the good conversation, the informed conversation on IMHO Talk Show. Stay tuned.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis, only on 101.3 Jams.
IMHO Talk Show, Charles, Max, Razor, Ron, and Dr. Ebony Hilton. So Dr. Hilton, where we left off, it made me think, in my head, like in the gray matter somewhere, I was trying to think of how to articulate it, but that's got to be real as I can be with it.
Just ask it just as it comes.
Yeah, that's right. And, so I'm going to make a statement sort of, and I want your opinion, because it almost sounds to me that we may just have to accept casualties of war. And what I mean by that is that to prevent from spreading it, right? Mm-hmm. If you have symptoms, you almost should just stay isolated to try to take care of it best that you can. Because at this point, with no vaccine, which is a question I'm going to have for you later on, if your insight, to medication and possible vaccinations. But for this question, it's like to reduce the risk of spreading it. We're better off taking the chance of just, like you said, calling a doctor and just staying isolated. So, to cut this thing off as fast as possible. Right.
So, for one, I always tell my family members, if you are bothered by something, then I, as a doctor, should also be bothered by it. Meaning that if you have any questions or concern, you should never hesitate to call someone and get some advice on what should I be doing at this stage. Because you may be presenting with some symptoms that they say, hey, come on in. Or they may tell you, okay, it sounds like, your breathing doesn't sound too labored. So when I'm listening to people, I can kind of get an idea of if you're struggling or not. Meaning that when someone's oxygen is really low, they won't be able to talk in a complete sentence like this without taking a breath. It's more so like, I can't breathe, that kind of thing. And if you're at that stage, we're already behind the 8 ball, right? So calling your doctor, like I said, if you have a temperature of 105 and you're nervous, call us. We want to hear about it. And the facility should be able to tell you of what symptoms that we want you to get in your car and risk coming, because it may not be that you even have coronavirus. I want to make this clear too.
Right.
What ends up happening, if you come into the hospital with a fever, for instance, the first thing we'll do is check you for not only coronavirus, but we'll check you for the flu first, because most common things being common, right? For one, because we have more flu tests, to be completely honest. But for two, because all these viruses present in the same way. We've all had colds before. We know kind of the signs and symptoms of what it looks like. But so we rule out whether or not you have the flu initially. Now, I don't want people to think after this conversation that if they're having severe symptoms that I'm telling them to stay home at all. I want to make that very clear. If you are concerned, if you are having any type of breathing issues, if you're feeling chest pain, any of the above that makes you nervous, we should know about it. Your doctor should be informed. I still say you should call as you're driving. If you're already in the car, make sure you call them first, because like I said, that hospital that office may be closed for one, because some offices are closing down because of the virus. But others may just simply tell you, I want to help you, but we don't have the resources to help you here. You need to instead go to UVA, or you need to instead go to wherever a testing source is to get tested first and treated. Does that make sense?
Yep, absolutely. So Max,
Yeah. So my question is, when you talk about being tested for the virus, what does that entail? Is that just a checklist of all the symptoms? And then the next question I have is, I've been privy to a conversation with someone who had symptoms that presented as the coronavirus, was tested for it, and for them, it took an incredibly long time to get the results back. So what is the turnaround time then to find out whether or not you're positive?
Right. So upwards into, so as far as the testing, this has been a bit debacle as far as this administration. So the World Health Organization actually had a test available that over 60 countries are using. Sorry about this, guy. But over 60 countries are using to this day, about now probably 14 weeks ago. So that's a whole nother side that we could talk about, that and the handling or the lack of leadership we have surrounding that on the federal level. But fast forward to the testing now. So upwards until, I want to say it was last Friday, all the tests that we would take at UVA had to be taken at UVA. And the way we do it is it looks like a long Q-tip. We stick it in your nose to get a sample from your nose, but it's not the most comfortable thing. We're now doing some mouth swabs too, and to substitute. But that's how we get our sample to see whether or not you have the virus. And not only that virus, like I said, we take that sample and we test it for the flu. We test it for a number of different respiratory, RSV, you hear it called, a number of different other viruses at the same time. But that sample was being sent down to the CDC in Atlanta for full testing. Now at UVA, I want to say it was on Friday, we finally got the ability to test it in-house. So the turnaround time now is more so on the scale of a couple hours than it was, like I said, last week. It was taking upwards of 7-8 days for people that were in the hospital to get results back. So, and that's just because the system in the CDC was getting tests from New York, from Seattle, from York. I mean, it just overwhelmed the process because we're used to handling 10 labs a day for picking out numbers. But like going from that to having tens of thousands of people saying, I want to know my results now. So it just backed the system up.
Gotcha. Okay.
Hey, we really appreciate all this great content. My question is going to be a little different, but what's the temperature like amongst you and your colleagues in the medical profession? How are you guys taking care of yourselves? What advice do you have out there for your nurses, your admins, and everything? And then, have you been communicating with any of your colleagues overseas, globally? Just want to get a little temperature for how you guys are feeling right now.
Oh, we are. So it literally is boots to the ground of talking to colleagues. So I have mentors that are over in Utah, for instance, and she's German. So she's talking to her colleagues that are over in Germany and talking to her colleagues that are in Italy. And I'm like, okay, what are they telling you? How are they protecting themselves? Because what we know is that 20% of all of the patients with coronavirus that are critically ill are healthcare workers at this point. And, it's one of those things of you literally have to think about, you're wanting to go in and help people, but you literally are almost feeling like, especially because of the shortage of the protective equipment, it's almost like a soldier being put on the front lines of a war without a gun.
Yeah.
So because of that, though, my biggest thing, there's periods of frustration because you see people taking this lightly on social media, and they're still going to spring break, and they're still going to walking down the street because I don't want to stay in my house, so I want to go to this restaurant, and I want to hang out with my friends. And you know that those very same people that if they were to get sick would come to the hospital and demand that you take care of them. And it's like, because of that selfish act, you're literally putting my life at risk of where I might not see, 2021. And it's one of those things, I think everyone that's in the health profession, we know we go to work every day and we're exposed to things every single day. And we do it because it's a calling or a draw that you want to help people when they're most vulnerable. So we just ask that in return that, that you do your part and you stay home and you take heed when we say don't go out. We mean don't go out. It's not just your life that's at risk. It's our life too. Oftentimes you hear, especially like I said, the lack of leadership on this was fumbled weeks ago. Right. But they constantly mention this is an old people disease. But the truth of the matter is 30% of the people in the hospital as we speak, and that number is probably climbing at this point, given what's happening in New Orleans and in New York. But 30% of people are between the ages of 20 and 44. So this is not a young people disease or old people disease. It's everybody disease. There was a 12-year-old kid in California who died from coronavirus, 12. So what people have to realize is that, yes, the older you are, the more likely you are to die. But this virus does not care if you're 82 or 22. If it catches you at the right period of time, if your immune system is even slightly compromised, and that doesn't mean you have to be on chemotherapy agents. That can just mean you're over one cold, and here comes this one. Or, like I said, some people can take penicillin, some people can't. Everyone's body is kind of different. So,
so Ebony, can I interject there? I had a question for you, because one conception, maybe a misconception, but is that you have to have some sort of ailment. You have to have a compromised immune system for it to kill you, not just to catch it before to kill you. Is that any fact to that?
No.
Okay.
No. I mean, does it put you at greater risk? Yes. You have a pre-existing condition, and that can be if you have chronic bronchitis, if you have asthma, if you are on immune suppressions for any reason whatsoever, then yes, your risk is higher. But again, we have a like, I don't know if you guys saw on social media the DJ down in New Orleans who died. Young guy. There was a young principal in New York who passed away, unfortunately. Like I said, a 12-year-old kid. This is not, how do you say it? I can't even get him in. I like to give like little analogies. It's literally, it can happen to anyone. And at this point, give you an example, like last night we had 403 Americans die in one day. And at the rate that we're going, by this time on Tuesday, Wednesday, we may be looking at 800 to 1,000 Americans dying every day, one day. And I don't think people fully appreciate what that looks like. To give you an example, like I said, worst case scenario, the CDC said between 200,000 and 1.7 million Americans not seen December. Okay. To give you an example, the lowest rate of that is 200,000, is about the size of Richmond, right? If we added Richmond, DC, and Charlottesville together and then multiplied it by 2, that would be the 1.7.
Gotcha.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis, only on 101.3 Jams.
So is there any vaccine or anecdote in the foreseeable future?
Right.
That was my next question.
Right. So people hear the word vaccine and they think, so vaccines aren't treatments. Vaccines are supposed to, so it's for your immunity to say, like I said, with this, the reason why this thing is so deadly is that your body has never seen it before. Mm-hmm. And so with vaccines, what we do is we give you a little dose of this virus, like a little dose of flu to get your body used to seeing it so it can mount immune response. So the vaccine wouldn't be a cure at all. The vaccine, in order to get it, most time people say, oh, just create one. But literally what you have to do to get a vaccine is to take samples from a lot of different people. This is why testing is so important. And not only testing, it's testing of all different types of people, Black people, white people, Hispanic people. Because the way this virus works is it inserts itself into your DNA, because it's an RNA. It's an RNA virus. There's 2 different types of viruses. The RNA virus has to insert itself into your DNA in order to get copies of itself. So the testing, what we do with the testing is say, let me get your blood sample. Let me look at your genetic code to see where along this code has this virus inserted itself. And so if I were going to create a vaccine, I would get a blood sample from you, Charles, from you, Ron, and from you, Nakia. Like, I would get everyone's blood sample to say what sequence along your along your genetic code is the same. Because since y'all not brothers and sisters, your DNA should be different. You're not identical twins, right? So because of that, once I isolate what that virus sequence is, now I can have something to serve as a form of as a marker to create this vaccine from. So that takes years. that takes the better part of a year and a half before you can isolate exactly which part of this genetic code is actually this virus itself and not a piece of someone's DNA sequence. Because I don't want to create a vaccine where you end up attacking yourself. Does that make sense?
Yeah.
That your antibodies recognize yourself and you start to have a reaction. We don't want that to happen. So the process of getting a vaccine is a lengthy one. Now, people ask about treatment options. And like I said, treatments usually take time to really see because every medication has a side effect. Even oxygen, you can have toxic effects of having too much oxygen. And most people don't realize that, or drinking too much water. We say you can actually get polydipsia, and that's not good for you. So every medicine that we throw on this, we have to know that it has also an equal side effect. How does that work? So there are a couple different medicines that they're investigating now. You'll hear people talk about the hydroxychloroquine.
Yeah, we're talking about that.
Right. I mean, it's one of the medicines that we use for rheumatoid arthritis or other autoimmune diseases. Whether or not there's been any promising trials at this point to say it's going to have any benefit, it's too early to kind of know. We've heard of the man down, I want to say he was in Arizona, who tried to take basically cleaning solution for the aquarium that had the chloroquine and died. We are going to tell people, even though 45 tells you to do something, every medicine has a side effect. Nothing is safe.
Don't do it.
Right, don't do it. We have to look and see if your medicine potentially interacts with another medicine. I mean, there's process to this. There's other studies that have been looking at coming out of China where they took blood samples from someone who has survived coronavirus, and we spin your blood down and we get the plasma form of it that usually has your antibodies. And they're giving that to patients that are on their final leg to see whether or not that can help. And it was only 5 patients. Again, in order to do stuff, you really need to see how everyone's body reacts to it, because what helps you may kill someone else. And so usually for these trials, we're looking at, many hundreds of thousands of people before we fully feel safe and saying, yes, this is a go.
Do we know how it started? Not where it started, not what group of people, but how?
Right. So you hear about animal transmission, which a lot of these viruses do kind of come from, but whether or not I know the exact origin, I couldn't tell you. All I know is that it was the first case has been tracked back to November 17, 2019 in Wuhan, China. So
okay.
Didn't it have something to do with like cross-contamination with a bat and a man? Is that accurate?
Right. And like I said, it's hard to, it's always, we would love to say we know the exact one person who got it.
Yeah.
What the matter is,
patient zero. Yeah.
Right. It's one of those things of, was it that? Was he the first?
Mm-hmm.
Yeah, I mean, we're just now getting tests available to check now. So was it that this person, November the 7th, was in contact with someone else 3 weeks before that? Because the incubation time, this is what I tell people too. You may not have symptoms of showing that you're infected for upwards of 2 weeks. You know, it may be that you were on a plane for spring break, and this is what I have to stress to the young people that went to spring break. You may be feeling fine right now and actually be infected, that if you went to an older person's house, you can give it to them and kill them. So if you were one of those people who went, and no judgment, but if you went to Fort Lauderdale or wherever else, I would say for 14 days, you need to be by yourself. Just by yourself and get to know yourself.
That's right. So Ebony, before we let you go, if we were a family in your doctor's office, like what would be sort of our takeaway message?
The takeaway message is that you are your best medicine at this point, that we can be better if we all work together as a group. Check on your community people. One thing I do is I send a message out to my neighbors to say, hey, for my older neighbors, I know that you guys are high risk. I know you can't go to the grocery store. Do you need something? Let me go. I'll drop it off on your porch. You know, be neighborly like that. Take the time to, I don't know, check it. Like I said, check in on people that's not necessarily even your family, but just realize that you may be the only person that's there for them at that point. Trust your body. Know that if you're feeling any symptoms, to call and get help. But know that you can. Who called?
Call them out. Point them out.
We lucky we in the chat room because we would have bust out like somebody did something in the club. But honestly, check yourself as you other situation, just that it can be you. Yeah.
Okay. That's good information. Thank you so much.
Yeah, this is so needed. Glad you had the time to take for us, Dr. Hilton.
Thank you.
And hey, look, and you did such a good job. Like, we're gonna go ahead and get in touch with you and get you in the studio as soon as we open it.
I tell you, so if you want to list the people, there's Cameron Webb, Leanne Webb, Tyson Bell. There's several of us Black doctors at UVA that will be more than happy. Rashonda Mitchell, who's OB.
That's right. More
than happy to talk to people and say, what does this look like? And you know, if I'm pregnant, you know, hear about people saying I'm pregnant. What does this do for my child? To have an OB give you information, I think would be kind of priceless. So if y'all need us, we're here. Let us know.
That's good. Good stuff.
Yeah, shout out Dr. Webb. Hopefully this doesn't hamper, you know, his political aspirations too much.
District 5.
Yeah.
District 5, right?
There you go. So yes, thank you once again, and thank you, family, for listening. Much needed, much appreciated. Yeah, good information from the good Dr. Hilton. So family, this is IMHO. Thank you for listening, and stay tuned. And Ebony, you take care of yourself.
Thank you. Y'all take care.
Thank you for all you do.
You too. Yeah.
Thank y'all.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis, only on 101.3 Jams.